welcome Stefano to the stage, and Stefano's already there. The Now, folks, I have to tell you, and if I think about it, I'm gonna search around and I might share one of these with you. But how I met Stefano, I have to say that he's brilliant with video and technology and sort of communicating different thoughts. But he has some of the most entertaining videos in the space of older adults that I've ever seen. I would see these regularly on LinkedIn, and they just put a smile on my face, and just, I felt that they were fun and communicated who he was and his personality really well. And that's how I reached out and we connected and got on here. But Stefano, you're the founder of this company, Carevocacy, but give us a little bit of the behind the scenes. Tell us a little bit about yourself and what led to you founding this company.
Yeah. Well, first of all, thank you for having me. Sometimes I don't sometimes I don't know where our videos end up going, but I'm glad it ended up in your feed on LinkedIn. Others might have seen us on our Instagram or TikTok and stuff like that. But again, my name is Stefano. I launched a company called Carevocacy back in 2020. And about 5 to 6 years ago, my family and I actually decided to become caregivers to my grandma, who is diagnosed with Alzheimer's. And so we brought her from the Philippines, had her stay with us at our house. And, basically, that was around my freshman year of college. So about 4 or 5 years ago. And from there, my family and I became caregivers to my amazing grandma. She is 79 years old right now. And so ever since then, that experience as a real caregiver, I'm sure, shapes all of us in different ways, whether we like it or not. But at the time, I was a business major, and I was really looking into trying to find solutions for really myself as a caregiver. I was trying to figure out, like, could I have my time back? Especially as a young person at the time, where I was like, I remember going from classes, in between classes, I would drive to school and then drive back home to feed her lunch and then drive back because I was the only one available at the time. My parents were working full time. My siblings were in high school. So I was the one that was primarily taking care of her for that kind of first year. And I thought that technology would be the solution that ends all caregiving problems. Obviously, we know that's not the case. But that's where I really kind of spent about a year looking into what it means to be a caregiver, what it means to be someone who's aging, to be someone who's building technology in products for older adults, and what does that mean for designing for that population. And spent about a year, and then bootstrapped the first part of it, launched it in the idea of teaching older adults about technology back in January of 2020. And can anyone guess like what happened in 2 months after January 2020?
Oh
Because I
yeah,
was I was in this like gung ho mode of I am going to teach older adults in my community as well as people in my city, and go to each individual's homes to teach about technology, and so that they would be more tech savvy. And then 2 months later, our friend the pandemic came around and basically changed and pivoted the whole structure and the journey of it. But ultimately, I think enhanced or emphasized how important it was for older adults in general to be more digitally literate. And also for all of us, it wasn't even just aging people. I mean, we were all aging, but it was everybody had to be more tech savvy during that time. And so ever since then, we've been helping learners learn about technology, and kind of giving them that empowerment to learn more about technology today.
I love your story, and especially as an entrepreneur, I often talk to other folks that are starting businesses in this space, and I always remind them, the really good idea, you might trip over it on your way to what you're trying to create. And you started this journey about trying to come up with a caregiver solution.
Yeah.
And, while I'm sure Caregosity helps caregivers because you need to be able to communicate with our loved ones and things like that. It if you didn't go down that path, you wouldn't have stumbled into it to where you are now. So, a couple of things. Somebody asked where you're based, and I happen to know you're based in sunny Florida. And and then Carevocacy, I believe, is it's nationwide. You have clients all over the country.
Yeah, so our team is mainly based in Miami, South Florida area. We actually serve in over 19, we've served over in 30 locations where we provided tech classes for older adults, but we're currently in contract with some health plans in Miami actually. And we've served over 23,000 learners across those locations. And then in regards to our national like services and stuff like that, like we've also provided private tutoring or online classes for people out of state. We also have 5 locations actually in Hawaii, working with the Hawaii Public Library System to provide digital navigators for their patrons there. So we're a little bit of, we can be everywhere, but mostly a lot of our work is in Florida.
Yeah, that sounds good. And I think I'm interested in sort of diving into how you do this and then tips, tricks, and things like
Of
that. And then
course.
also a little bit about AI. I think that you're utilizing that. But before we talk about that, I think there was something that was really fascinating, and I believe you and I were having this conversation when we first met, is that you have partnerships with health plans, correct? Because let's face it, folks. I mean, I thought this was brilliant. And when I go on my insurance company website, as somebody who uses technology all day long, it can sometimes be challenging. And this is this wonderful area where the provider and the consumer can receive better services by being more tech savvy. And so some of these um, pioneering insurance plans have realized that if they work with you, then their customers are going to be able to utilize the website a little bit better. It's going to cut down on the phone calls, and everybody's going to be happier.
Yeah. Um, So I guess I can start with here like a terminology in healthcare that a lot of people have been using to kind of describe like the basis of why digital literacy is so important, and that is like social determinants of health, which is basically a terminology that most people don't use, but a lot. It's basically in general, it's if you think about it, there are a lot of categories that determine a person's health, right? Access to education, to healthcare, to housing, to food, to social connection. Those are kind of like the social determinants of health, right? Those are the categories that define whether someone's healthy or not. But when you start to think about it, especially today, a majority of those things needs to be accessed through technology. You need to have a form of digital literacy to be able to even have access to education nowadays, to order food probably, or to even have social connection, like hopping on a Zoom webinar like this, right? Like to foster some sort of relationship with other people, or to get some sort of service, you need to have some sort of digital literacy. And so that's how we approached the health plans and said to them and say that, look, I think they're doing an amazing job in providing some sort of these services for older adults in general through these plans and benefits. But maybe we could probably have an add-on that really can turn the wheel on how can a patient or a member utilize your services if they require a form of digital literacy. And I think we're addressing those things. And um, we're not necessarily the first to be in these things, but I would say we're one of the companies that definitely are very hyper focused on bridging the digital literacy gap in regards to making sure that the person feels empowered and that they're having fun, and but also like helping the health plans actually be excited about something like this, because it's something that I think for a lot of people, they think it's a nice to have, but definitely there's a lot of things coming our way that have turned a nice to have to a must have. And I'm happy to say that we've actually partnered up with Humana, which is one of the nation's largest health plans, to provide tech classes to their members through their primary care organizations. And so that's been a really interesting relationship. It's I was just actually in a meeting with them before this one about where we are going to be in 2024. And so I'm really excited about that. And as I said, at the end of the day, it helps a lot of our older adults be more tech savvy and to have access to healthcare that they maybe have not thought of that they can have access to just because of the lack of digital literacy, right? Like scheduling your own appointments or doing telehealth. Like those are the things that could really lessen the burden on caregivers where it requires them to physically bring them to somewhere when they could actually have access to technology right in their fingertips. So those are some of the things that we've been able to accomplish with the learners that we work with.
I love it. Okay. Well, I'm gonna pull your website up just for my own purposes here. But we have but Amber asked a question. Do you do one-on-one tutorials or are you working just through Zoom? But let's address Amber's question in a little bit of a different way. So from the user experience, and so let's say that I'm on this webinar and it's sort of like this all sounds good to me. And so you come to your website and you can see where there's different levels and different pricing, but tell us a little bit about what the experience is like. And is this totally digital? Because a lot of your videos, I see people dancing around in fun. Give us an overview and then we can dive into some of the detailed questions.
Yeah. So, and thank you, Amber, for that question, by the way. That is something I always have to answer every time we work with groups of people. So, we do. So, we have actually three interventions. We have our private tutoring, which is one on one. That is mostly done online. And then we have our group classes, which Steve has been able to see that we provide them on site as well as online. And so those are kind of the fun content stuff that you get to see on our Instagram or LinkedIn or TikTok. And then our third intervention or third solution is actually a text-based, an SMS-based digital literacy coach that's powered by AI. And what basically that does is your loved one or yourself, whichever one, any lifelong learner out there, can simply text our special number and any questions that you have, like technical questions or anything that typically what you would ask someone who might be more tech savvier than you can ask that question to our AI digital literacy coach, and then that coach will walk you through step by step on actually how to learn that specific technology that you asked about. And so we have three different solutions that can help people depending on their learning style. Unfortunately, we're not expanded to basically be able to do one-on-one tutoring in person. But then also, we don't try to do that just because it's for safety reasons, not only for the learner, but then also for the tech tutor. And so we try to mitigate those things. But then, speaking about what Steve was saying about the dance videos and the fun little TikTok trends that we get to do, as I mentioned before, like we partnered up with Humana, who oversees about I believe they have about 250 locations through their primary care organization. We partnered up with Conviva Care Centers here in South Florida to provide tech classes to their patients in over 19 locations. And so we do that in person. That's where most of our classes are held in person. And then, as I mentioned before, we do have also like on-site stuff that we do. And then I did see somebody's question right after Amber's. Is it okay if I
Oh
answer that
yeah,
one quickly?
yeah.
Yeah.
Just
So no, I was just going to say because it relates to the on-site classes because of the population that we serve. So we do provide our classes in English, Spanish, and Haitian Creole. So it's a really diverse set of older adults that we work with, and so it's been an interesting relationship, as I said before. But those are kind of solutions we provide, and it's if you hop on our site, it's like it's we don't so the first thing I would say is we don't tell you that this is the best solution for you right away. Like we want to get to know you first, and then we want to get to know like the people around you that wants you to learn about technology, and then see which what fits with you, and then we try to match it with somebody that could actually help you. Because I think what the mistake that most caregivers do, and even lifelong learners, is that they think that they have to learn this piece of technology, like the iPhone or a Google Home or anything like that, right away. But then the mistake that they make is that they don't actually learn the person who's learning, like holistically, like what are their actual needs in the moment, and then can technology really solve that? And if it's really technology that can solve that, maybe there's other practical ways to do that instead of just shoving technology in front of people's faces, right? I know this sounds ironic coming from someone who actually has a tech company, but technology is not always the answer. And I think for a lot of people, they could understand that, because maybe it's just like simple things that you need to have. And I was sharing with somebody where they were talking about, do I need to purchase a tablet or an iPhone or something for my mom to check in and how she's doing? Do I have to put cameras to survey her and stuff like that? Um, that's not, I don't think it's necessary, but if you feel like that's comfortable, if they feel comfortable and you feel comfortable to provide that, then I would go for it. But maybe there's other ways to, be able to communicate whether they're okay by simply having a watch or an app on the phone that you can just tap and say that I'm okay. Things like that, that doesn't require anything too heavy on technology, could really be helpful for somebody.
That's great words of wisdom. I think we're all guilty of seeing this fancy technology that our friend is using, or a digital device. You go in and you buy this thing, and it just gathers dust. You never use it. It's really kind of cool, but I really like the approach of holistically getting to know somebody, and then being willing to say that, the iPhone might not be necessarily meet your needs. One thing I get a lot of folks there's a lot of apps out there for caregiving and communicating with families, and they do a great job, but it's another login, and it requires that you actually use it. And it's sort of, a lot of times I'll basically say to folks is, why don't you just try doing this the old fashioned way with a notebook and picking up the phone and calling each other, or come up with some email threads. And then as you begin to see what the infrastructure looks like, then maybe some of these apps will be very well suited, because we don't want to add your whole family to an app and then nobody uses it, you know.
Yeah. So here's a funny story. Was doing when I was tutoring one person in January of 2020, and she had told me that she wanted to learn how to use password managers to save all her passwords on her iPad. And I asked her, I said, where do you keep your passwords right now? And she said, oh, I don't. I just kind of have to remember it. And I'm like, well, how can I expect someone who's not that tech savvy to download an application that is to save all your passwords, and then for her to navigate through the password manager, like, password dash or something like that? I can't, they can do it, but it's really not. I think the best way to build habits is doing it through like basics. Like I asked her to, and I know this may not be recommended to all, but I asked her to write down her passwords on a notebook, and I said, like, this is what we're gonna do. You're gonna write down everything that you can, and then when we get to that point where we feel comfortable, then we transition to using a password manager. But she needed to get that idea of, whenever I have to make an account, I should write it down. I should also date it. I should also, know the email that was associated with it. I should know this is information that she should know, and build the habit of kind of remembering these things, because, password managers are a luxury. They're great, but they're useless if you don't know how to use it, and you can get locked out of it. And the irony is that, because you forgot your password. And so, basics always work sometimes, rather than just the use of technology.
This is great. And I love this question here. And it's an anonymous question, but I love it because I have to tell you, this guy's great, Stefano, but our community is great. And the question is, how are your grandmother and other extended family members? Who cares for your grandmother and other family members now? And did your grandmother or family have needs, social health, that were met or being served by any of your services. The Whoever asked that question has the spirit of Stefano, because I got on the call today with Stefano, and he said, "How are you doing?" And I said, "Good." And then for the next 15 minutes, he was diving deep into my why am I good and a little bit about that. So Stefano, we're turning the spotlight on you. Somebody in the audience wants to know more details about your grandmother.
Yeah. Look, I appreciate it, and I am so grateful when everybody gives me the opportunity to share a little bit about what that feels like. Um, yeah, no, my grandma's great. Her name is Phoebe, or her I guess her other name is Alpha Vita, which is in translation called Faith is Life, but you can call her Phoebe. So she's doing really well. She is in the late stages of her Alzheimer's, and so it's a little bit difficult to get her to do certain things. We do have to actually physically get her up to eat, to go to the bathroom, to dress her, and things like that. So it's really just me and my family. My family, fortunately, is a family of healthcare workers, and so I also I'm not a healthcare worker myself, but I did volunteer at a hospital in the ER, and I know what patient care looks like. I've seen it through my parents as well too. My siblings also went through our MAs or medical associates as well, and so I'm sorry, medical assistants. And so we as a family are fortunate enough to basically be able to know how to handle patient care, but it doesn't make it any easier, especially when it's your loved one, because sometimes there might be things that you're okay with doing, but you might not be doing with other patients. And so sometimes you need to have outside help. To be truthfully honest with you, we've reached out to other people. I've tried to reach out to other people as well too, but I feel like sometimes, like especially in, I guess I don't know if it's just applicable to immigrant families or to just families that like are in healthcare. We tend not to reach out to a lot of people. It's just like that. So sometimes we could do a little bit better when it comes to that thing. Um, like for example, I'm in the age tech space, so I've been fortunate to have contacts and relationships with other companies who are developing products for people with dementia and Alzheimer's, and sometimes I kind of lean into their help and see if they have resources as well too. So I try to practice that as well. And then going back to your last question, excuse me, who does has my grandma ever benefited from like services or like from mine or any government services? So not necessarily, because she is at a different stage in Alzheimer's that unfortunately that any of our services would not work for her. Not that it wouldn't help her, but unfortunately, it's a very late stage of Alzheimer's, so it just wouldn't be able to do anything really.
And,
But
and is
yeah,
your family caring for her at home, or?
yeah. So she lives with us. So there's five of us, and then we added grandma, and now there's six of us. So yeah, so my sister and I, my brother, as well as my parents, we have like certain schedules. I give her the medicine. We have like who feeds her in the lunch, and so yeah, and it also it was in a way the pandemic was good because we were all at home. If right now like we have work and we have lives to live outside of taking care of our grandma. So it's about making sure that we have a schedule. We have a family calendar that kind of coordinates these things. So see, like we don't use an app, we use an existing thing that's already been out there, which is like a calendar to do that. So we have those things like that in place. But I will say that because I mentioned before that I started this company as a caregiver, a lot of our products is associated with really my grandma. Like my grandma was an educator back in the Philippines. Like she worked with special needs students and as well as, became a superintendent. So it kind of is a little bit full circle moment where I am an educator myself now, right, about technology. And a lot of our products, it's also designed around my experience as a caregiver. For example, our artificial intelligence would have like which we'll talk about a little bit later is actually named um, after a Filipino phrase called Apo, which is APO. and it's actually the Filipino word for grandchild. And I remember in the first year of taking care of her, because she didn't really remember, she didn't remember my name, and I didn't, there was no problem with that. But she would call me Apo, 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 come over here, Apo, Apo, because that was saying grandchild, grandchild, come over here. And so from that experience, I was able to take that word and put that as the name of our newest product, because ultimately we end up being grandchildren at one point in our life, right? And so how can we be a service to someone? And I thought that would be a really fitting name to have a
Well, I'm glad you
grandchild
said
AI.
that. I'm glad you said that because I've seen the Apo on your website, and I have, it's so hard to keep up with this AI stuff. I'm like, should I know what that means? And I'm glad to hear that it's proprietary. And this is a great transition because the AI is in the news, and if any of you have used like Chat GPT, it's absolutely amazing. But we've been talking about AI, but it seems like an explosion of products and services, and we're starting to really see the practicality of these things. It's not novel anymore. And you all are using AI. Tell us a little bit about how this works and what it does.
I can actually, do you mind if I share my screen? Is that okay?
Absolutely.
Oh, yeah, okay.
Should be
I
all
should be
set
able to
up.
do so. Yeah. Um, as I was saying earlier, y'all, like if you go on our website, like we have a button that says you can start learning, but which is basically like a questionnaire to learn more about you. But if you want to skip through all that and you just want to try it out for yourself, we have a tab right here that says Apo AI, and then it will take you to a website called apotutor.com. And basically, as I mentioned before, it's a text-based product. So all it doesn't require anybody to download an application. They just have to provide their phone number and their email address, and then they will get a text from Apo, like our little mascot, which is basically a Filipino tarsier. Um, and they'll get receive a text, and it will let them know like, hey, you can text me any questions that you have about tech questions, and I will try to tutor you or help you learn. And then any questions that they may have will be answered via that way. And the reason why we created this was because it's not a replacement to your grandchildren, by the way. It's I think grandchildren are a plus, but for folks who don't have a grandchild or they don't have access to somebody who can answer their technical questions, I think this could really be helpful for them. It's a free tool, by the way, that people can use and text their tech questions to. And so it just opens up the opportunity to use AI in a very practical, pragmatic, and useful setting instead of all these like, hype buzzwords around AI. And so basically, yeah, it's just someone you can text and have a social conversation with and be able to get back to you and teach you in a way that is helpful for you. And so that's what our product does basically. That's what Apo AI does, and you can ask it questions on like online safety, writing an email, telehealth access. It just basically makes it more accessible for someone to have a tutor on hand. And the reason why it's free is because, as I said, like we want it to be accessible. We're creating products that everybody should be able to use, that doesn't require a lot of too much digital literacy. And also, AI has been so helpful in scaling a lot of the things that we were able to do, and the impact that we were able to provide. So, my hope is that this tool will be able to give someone a little bit more of a like energy to be more tech savvy or to be tech curious about things, because now they don't have to feel judged to ask a question when they ask like their grandchild, like, how do I work this TV or something.
And Catherine, you're reading my mind. Catherine says, could he illustrate the actual utility with the product? Do you feel comfortable?
Oh man, I wish I could do it on my phone. I don't have my phone connected to my computer right now, but I know this sounds so cheesy to say, but the best way, Catherine, is to actually try it. So if you don't want to, you can try it, and then if you want to email us and say, hey, I don't want to, like be signed up for it anymore, then you could just let us know, and then we'll
Okay.
cancel the account. But unfortunately, I don't have like it's very basic to explain in regards to what it does, but I don't have my phone connected to the computer right now. But as I said, like once you put in your phone number and your email address, you'll receive a text from our special number, and then you're just texting somebody as if it's just somebody you're texting those
Oh,
questions
oh,
with.
wow. Okay, that's kind of interesting. Okay, that's a different approach. So it's and I'm glad, Catherine, you asked that question because I now see with the graphic on the screen that this is more of a text base,
Yep.
which makes it very convenient. You don't need to download an app, which is wonderful. And okay,
So
that
yeah, so it works for Android, iPhone, um, and it's just using the messaging app on your phone that's
got
already
it.
there.
Okay, and we see the sample there. I think this helps both me and Catherine. It's how do I take a picture on my iPhone? And there you've got the easy step-by-step instruction. And yeah, again, I don't think that it's necessarily this is probably a good thing for all of us to have uh, on our on our message list. These days when I'm trying to figure out where the heck the camera is on my.
Yeah, I mean it's a supplementary tool, right? So like let's say you have a loved one or a lifelong learner that wants to learn how to text better or text more, right? And so it might be useful for them to basically be able to text this number that isn't going to get tired of you texting questions or things like that because it happens and it it
Okay. Now this is all I'm starting to put it. I know I'm a little slow sometimes,
no, don't
but
worry.
I can tell you that I have conversations with adult children who are saying, yes, I'm getting, X amount of calls or text from my mom on a daily basis. And if some of those could be deferred to an AI, cute little AI tech tutor, it's mom's going to be proud of herself. And now, instead of her asking you a question, she can tell you how she is taking pictures and how
Yeah.
she learned that. Okay, I
And
like.
so yeah, I was just gonna say it puts learning in the hands of the person, and they're more independent in that way. So, um, and it's not a replacement of your grandchild or
No,
adult
no, no.
children. It's just it's a supplementary tool, so that way it's also not on, and to be honest, like sometimes it's on the burden of the caregiver to provide these things all the time. But it's really to basically be helpful for somebody, to be accessible for somebody, and in general, helping somebody learn on their own and be tech curious about it. um, and uh, and also, oh, sorry, I did see a pop-up question. Should I answer that, Steve, or do you want me to
Oh,
wait?
yeah, go ahead, but just make sure you read it.
Yes. So I see that Amber asked about where do the answers from Apo get? Sorry, where do Apo get the answers, and then can we train it like Chat GPT? Um, excuse me. So great question. So full transparency, it's nothing a trade secret or anything like that. So our AI is actually built on Chat GPT's AI. Um, and I don't know if I should go very technical about it, but basically we use the skeleton that they sell to other companies as well, and we built it on top of that. The only difference is that we've actually trained it based on the data and experiences that we've had over these past 3 years on teaching people, especially older adults, on how to use technology. So
Mhm.
that's really the unique differentiator here, where if you just use ChatGPT, or the app itself, it can be very generic, and it might give you basic answers or complicate depending on your prompt. But we've made it really specific to helping somebody be held accountable to learning how to use technology, to follow up, to know that they're speaking to probably someone who is not comfortable with technology. So we've definitely trained it based on the experiences that we've had over the years when it comes to working with lifelong learners.
Great. And Amber had mentioned also that there was just a CNN article on ChatGPT regarding common health questions, and they, did a test, and only 25% were correct. Okay. And I'm glad that Amber put this in to chat because I think there are some areas where AI can be very helpful, and this is one of them. In terms of where it's can give you an answer very quickly
Mhm.
for something that is practical and useful and not life-threatening or could cause irreplaceable, problems. I mean, having an automated system to help us figure out where the camera is on our phone is a wonderful thing that saves a lot of people time and energy and money. Um, the okay, oh, now I like this one here. Is From Ed, and so this is a technical question, Stefano, so I hope you're ready for
Okay.
this. As Ed says, I'm interested in knowing more about bringing Windows up to the current System 11. I had to teach myself how to use passwordless signons and use the 2FA and facial recognition using password vaults like Dashline. And finally, are we ready to are we ready to use passkeys instead of passwords? We need to help out older adults so their identity is protected. I'm curious about your thoughts on Ed's statement slash question.
Yeah.
And are these the types of things that your program addresses?
So, thank you for that question, Ed. Um, in regards to, I just want to say that I personally do not like when companies throw out an update and then change the whole interface for everybody. And then they're like, hey, now you're required to do this thing in order to get online. And I'm like, wow. It's not only annoying for older adults, it's also annoying for like people my age as well too, because it's a little bit of like a shift. But from what I understand is that all these updates is always about security and making sure that your data um, is inaccessible for people who are trying to get it. So it's a double-edged sword. You know, updates are annoying, but they're important, right? So whenever I get a question about updates, especially when it comes to like software like Windows, um, and like operating software like the iOS. Those are important updates to be made just because they might have security updates that are helpful for your phone. Now, in regards to um, passwordless signups, I for sure can confirm with you that those are optional. They just are not like obvious, right? And so I have seen, like, for example, some of our clients use passwordless sign-ons for facial recognition. Like, for example, their iPhone when they do Face ID, or if they have a Windows computer. Um, those are options. You can always go back and revert it back to like a simple digit password, anything like that. I don't think they will ever take it away from someone to just simply do like only Face ID. I haven't really heard of any company that would just solely do that, because you can always have the option to do like a numeric characterized password instead of just like a facial ID. Um, but I do think I personally use Google's password manager because it's within Google Chrome, the browser itself. So it helps. I use the Google Chrome browser all the time. So if I ever make an account, I just have Google's password manager save it for me instead of like another application. Because if it's another application, I have to log into that application and then I have to go through another step. So I use something what the browsers already provide. Most browsers already provide a password manager, like I believe Firefox or Microsoft Edge provides password managers that are in the settings of your browser. So I use those instead of like other password managers. But honestly, it's totally up to you, Ed. We're not a advocate for this is the only way. The thing that we do is to know that we try to do is that you have options, right? That you're not like tunnel vision to do use this one piece of technology. And I think that's the problem that most caregivers or people who try to teach older adults about technology is that you just have to do this. There are certain things that you have to do because it's the only technology that can do that. But for most things, there are options. So I don't have a specific password manager for you to use, but I would say most of those are pretty good. And then I did want to address that one comment with Amber about the medical um, thing about the AI. Yeah, don't stick to don't trust the AI to give you medical advice. Always talk to your physician or your primary care. And then from our side, like we try to train our AI to not provide any medical information. Um, we invite you to break it, by the way, if you want to ask it silly questions, but we don't recommend asking AI any medical information.
And Sherry is on the discussion today. Somebody who's really been doing a lot of research on AI, and she mentions, that it can do 20 languages, and they forget that like voice technology like Google Home and Alexa, that's another great example of AI, where you ask Alexa a question and she answers you. I think the beautiful thing that I like to see that's happening here is where, it's no longer is it I have to log into my desktop computer with my little floppy disk and all of this type of stuff to get information is that it's on our phone, it's voice, it's that I love the way that you've applied this through a text-based app. There's just some really clever implementation that's out there, and we embrace what is comfortable to each of us. The I did drop into the chat and I connected Stefano with this company, GoGo Quincy. We did a discussion with them not too long ago. And for those folks with the tech questions, take a look at what they have to offer, because and they have a little free thing too. So that might be an appropriate way to do this. But
Yeah.
Stefano, you talked about your classes, your face-to-face classes being primarily based in Florida and Hawaii. We have a large, group of our attendees are from the Mid-Atlantic. It are Do you have a vision or plans that you would expand geographically into different regions?
um Not that I can reveal everything today.
Okay, got it, got it.
So um I guess this is so we do have plans. Yes. It's never, we would love to extend the impact that we do physically into other states as well. I think learning at a location with other people is like a really good place to foster education and learning, right? And as well as accountability, which is so important when it comes to learning. Um, but our primary focus for 2024 is really to expand within the state of Florida. Florida has one of the highest population of older adults in the country. And so we do have a lot of people to work with in the first place when it comes to physically helping people. When it comes to helping people out of state, our recommendation, our solution is always using our technological solution. So whether it be our online private tutoring, our online classes, or our AI, which we recommend because it's way more accessible and easy that way from our end, as well as I'm sure for the person that's learning. Um, and so that's the only thing that we can offer for people out of state. We're always welcome to people out of state, help people out of state. It's just that we're not able to reach you in that capacity when it
It's
comes to
not face
physical
to.
stuff.
Yeah, exactly.
Yeah. And then the only thing I would ask of you is ask your health plan if they cover the because the best way to advocate, right? Because that's within our name. Carevocacy is a combination of care and advocacy. The best way to advocate for tech education is to ask people, in your community, your health plan, your government, your city, do they offer tech programs for so and so. And most libraries do that. Most I know a lot. There's a few nonprofits I can name in other areas and states I would love to share as well too. Like as you mentioned, Go Quincy is a good company as well too. Like if we're not the best solution, I recommend working with somebody local. Um, but the only thing I would say is find something that works for you in your learning style. Don't there's always something that could help you. You could also reach out to local, like for example, we've worked with like high school students as well too, who've started their own clubs that help older adults learn about technology. They may have something there too. So it's
Right.
always about advocating for those things and speaking out and communicating that, hey, we need to build something for that. And if our technology solution could help you in expanding that initiative or helping you in that, we're more than happy to partner.
I
But
love it.
yeah,
Cool. No,
I
no,
mean, I
it's
would
good.
love to be more than just Florida, but
Yeah. No,
we're
but
not there.
hey,
We're
you got to
not, yeah,
start somewhere,
yeah,
but it's but if you can dial things in a geographic region, there's no reason to, just like AI, that can be replicated. But
of course.
okay, Peggy has a question. My mother has trouble understanding the difference between your desktop files and the internet, and between websites and apps. How do I explain these? Peggy, I love your question, and I'm curious, like how a problem like that, how would you and the Carevocacy team approach that? And I imagine this would probably come up in like a one-on-one tutoring session.
Yes. So when it comes to something more specific, right? Um, and depending on like where your mom is at, Peggy, um, we'd have to one we want to know how she came to learn or use technology, what's her background and stuff like that, and then we base off of the things that we've learned about her, we try to pull references and analogies and anything that would make the conversation about desktop files and internet a little bit more easy to understand. um, my recommendation, I know this is going to be sound really salesy, but I was going to say ask that question to the AI and maybe it might give you a way to tell your mom. But how I would approach it is so I'll tell you a story about when I was telling this learner about how the Google Cloud works. And I gave her the history. I'm sorry, I taught a class about the technology of the cloud. What I did was I gave a history lesson on the timeline of how we've been able to contain data. So from floppy disks to flash drives to hard drives to a computer sized drive to now we don't even touch it anymore, right? And so I had to give that group of people a history lesson of how we got here. And that's how they were able to really understand what the concept of the cloud is, like what the cloud was. So, depending on your mom, you can either give her the history lesson of what desktop files and internet is, or you what we would do is we would try to kind of like understand a little bit about where she's at, how we can help her, and then kind of create a curriculum around those topics and build her up so that she feels comfortable in learning how to use her
So
computer or the internet.
So what's interesting is, Stefano, when you were talking about that and you said, I can't use your AI bot, but Peggy, what I did was I typed into ChatGPT the question as you stated it, and it's sort of like, sure, let me break it down into simple steps. And that this is very well stated, and it might be a tool that you could use the next time you're with your mom
Yep.
as kind of coaching through how to explain something.
If you haven't used ChatGPT before, I would try it out and use it. It can help you create a lot of I also tried to have it. I also asked it to create like a itinerary for my mom's 50th birthday, because I was trying to figure out like what we would do for her. So yeah, I welcome it. As I said, at the end of the day, like you can ask these AIs to help you learn how to do these things, but for most learners, they appreciate when there's somebody there that can hold them accountable and kind of walk them through that process. And it's been really good to hear that a lot of light bulb moments has have happened because of the
Yeah.
things that we do.
And GJ says desktop files are shouting across the house. Online files are calling someone on the phone. And talk, but what's cool is talking to just friends. Like if that idea resonates with you, that can sometimes be a great solution.
Yeah.
The Now, I'm not sure if you know. Somebody is saying, what do they mean when they said Chat GPT is now closed? Um, do you know what they? Somebody had a question about that.
I'm not too sure. I'm trying to read the whole thing. I'm not too sure with your question,
Yeah,
but we've actually helped out somebody who wanted to learn more about ChatGPT and Google Bard AI, and he's an 89-year-old, I believe a veteran, and he asked ChatGPT to negotiate his lease, to like read the contract and then find a way to like work with the HOA to, I don't know what it was, the lease or whatever it was. And he was able to basically take the points from ChatGPT and negotiate and be basically, have a little bit more of a better understanding of how to navigate that conversation. So we've been able to help people that way. It's been really cool to see older adults use AI. I was actually going to quickly share with you, one of our learners created this image of this cat through generative AI. So they use like an image AI image generator, and he put in like a cat in Santa Claus outfit, and that's what it generated. I don't know if you can see that, Steve,
yeah,
but
no, it's beautiful. Yeah,
so he was sharing with me about how he was able to do that, and use AI to generate an image.
yeah, no, I love it. And let's see, Sherry, I dropped this into chat. She says, I think they're confused about Chat GPT. They're probably referring to the ousted chair who is back now. Yeah, there was a lot of that in
Oh,
the
I see.
news. Yeah. And yeah, and the potential that the company could be shut down and go to Microsoft. But okay, Ed has a question that I want to make sure we address, and I'm looking,
Of
we're
course.
almost to the top of the hour, so we're gonna also try to wrap up here. But Ed says, I'm worried that my independence is going to be affected, like losing the ability to drive. Is it coming to the point where I'm going to eliminate the use of PCs or iPhones? And I guess, Ed, you're sort of referring to sort of voice technology and other devices. Um, Stefano, do you have any thoughts on Ed's concern?
You know, I think you're I think it's all right to be concerned, but the only thing I would say about that is the one way to not be worried is to be educated about what is going on in the world of technology and how you can best protect yourself. You know, I'm sure a lot of you already know that, bad and good things will always happen, right? But the best way to prepare ourselves for those things is to basically be able to know how to use it, navigate it, know that it exists so that we can prepare ourselves for when it does happen or when it doesn't happen. And, I try to tell my our learners and say that, um, because, every sometimes it's, they're a little bit fearful of like, if they click this button, it's going to end everything. um, but if they knew that if they clicked on that button, that it was just going to close the app, then they're fine. Then they're okay, right? They're not anxious about that. But for most people, they are, because they just don't know what's behind that closed button. And so, it is natural to feel concerned about the technology today. But, my ask is that you challenge yourself, you stay tech curious, and to be aware of what's available to you so that you're able to know what your options are and that you're able to not be too anxious about things like that. I don't think they're going to eliminate PCs or iPhones. I mean, those are still technologies of today that we need to communicate to each other. So those are going
Okay.
to be there for a while.
And then I like finishing this off with Rita's question
Of
because
course.
it's a great one, Rita. And I know like we have so many different types of people and different backgrounds from older adults to families to providers. And what Rita says, and I posted it for everyone, QR codes, they're everywhere. How the heck do I use them? What is Chat GPT? All the viewers here today are cards and spades ahead of me. I would call this an advanced class. And Rita, number one, first off, we didn't intend for this to be a class. More, we're just a conversation on how can we make life easier for older adults or people that don't understand tech? And your questions are very relevant. It just so happens that the company that Stefano has helps people navigate these questions that you've got, along with some of the other resources that we have. And so I think the important thing for you, Rita, is that there are people out there that can help you. And one way to start could be reaching out to Stefano and his group. We've got a few other links
Yeah, it could be
added in
other
there as well.
nonprofits or other companies as well. I was just gonna say, Rita, you're on the right path of one being here, asking questions, which is so important. Most people don't even ask questions about something they don't know. And whether I know this may feel like it's an advanced class, I love that Steve said like this is a conversation about technology and what it means for people who are aging, which applies to all of us, by the way. So we're all in this journey.
Oh, and Rita, I have to tell you, so QR codes, they drive me crazy. They are it requires actually, I mean, one of the downsides, QR codes are convenient because you see that code, and if you're smart enough to know, or smart enough, if you've got the knowledge to know that I got to hit my camera, and then it's like I'm taking a picture without pushing the button. But what bothers me about QR codes is it's very difficult to navigate, no matter who you are, to that little yellow thing that pops up, and a lot of times I miss it. And I think it's easy because now it's easier because now we're not typing in a website address to get somewhere, but it can also be more difficult, and depending on our dexterity and our vision, could be nearly impossible. And Rita, feel free to reach out to me personally if you got an invite for this event, and I'm happy to connect you with Stefano or some other tech options if you feel like that would be helpful to you. But there's people to help you. Okay. Um, let's see. Okay. I always say this, the last comment, and then we get another one. But it's Ed is asking any comments about Comcast. And now, Ed, I would frame your statement as Comcast is not the only one out there. Uh, there are a lot of internet providers, and I don't care who you are, what your age, this can be really maddening to navigate. Who do I choose, and how do I, negotiate my bill and all that type of stuff? Stefano, any words of wisdom there?
um, so I haven't been able to do that yet. So I don't have any words of wisdom in negotiating my internet bill. But as I said, not that we're the only option, but use ChatGPT or other AIs to help you create a negotiation for that. Um, because if you can't be if you're not able to help another human to help you kind of figure out what to do with it, I would recommend that as an option for you. One, because it might have it might put some thoughts that other humans may not have thought about. But it's a very helpful tool. And as I mentioned before, like we're not the only ones that can help you. There's other companies as well or nonprofits that can help you in learning how to navigate through that. But I don't have any comment for Comcast per se.
That's great. Yeah,
I
you
just,
know, it's
I would
kind of like
say,
talking, it's sort of like bringing up a political question. I
no,
mean, you
I
know,
don't have
it's
any,
sort
I
of
don't
like,
have any questions. I was, if you don't mind, Steve, I know we're ending soon, but I just wanted to share a quick video of like our fun stuff that we do. Is that okay?
oh, no,
Yeah.
absolutely. Yeah,
Yeah.
let's close on that. That's a great way
Yeah,
to
so as Steve mentioned earlier, that the reason why he found me was because of the fun content that we do, and so we've been able to make a lot of TikTok videos and fun stuff. So I just wanted to quickly share like a fun video that we did with our group of learners. It's on our Instagram page, carevocacy.co, and then if you click on the first one, this is basically like this is how our format looks like. We have our tech tutor. Her name is Yvonne. She's wearing our purple shirts, and she basically is teaching these lifelong learners about navigating their phones and text messaging. And so those are just kind of like the fun stuff. Like I do like TikTok dances too. Like this is like a really fun video that we did to kind of like enhance the moment of like having fun at a tech class. And a lot of our learners really enjoy being in these TikTok videos. And we've reached over 3 million people through our TikTok videos and the fun stuff that we do. So yeah, it's just like fun stuff like that that we try to like help people out, and also just kind of changes the narrative on what it means to learn, because sometimes when you see technology and older adults, it's always that like unfortunate stigma. But thanks to my marketing background, I want to showcase that, you know, learning is ageless, learning can be fun, and learning can be the way that you want it to be. So that's I just wanted to end it on that.
Oh, I love it. They're just some really fun and amazing videos that you put together. So this has been a great conversation, folks, and I will get this recording up as quickly as I can. I'll put Stefano's contact information on there if you want to reach out to him. And if you end up, uh, oh, somebody asked, did you get consent from everybody who was in that video?
Yes, we did.
The answer is yes. Okay. All right. Must be a lawyer that asked that question. Okay. This is great. We'll see you all. We got two more discussions for the end of the year, but then we'll take a nice little break. And Stefano, if I don't talk to you between now and then, have a great holidays. You're doing wonderful things for the community, but it's also a really inspiring story to hear about your family caregiving model.
Thanks so much, Steve. I appreciate you and appreciate everybody. Thank you so much for learning more about what we do. Have a good one.